And good evening if you're in Australia, good afternoon if you're in Israel, and welcome to another Technion Australia webinar where we give you the opportunity to peek into the world of our scientists and get a better feel and understanding towards their work. Particularly excited today as we're hosting one of Israel's greatest, perhaps the world's greatest scientist, a Nobel Prize laureate no less, Professor Aaron Ciechanover. Aaron, thank you very much for making up the time and being with us today. My name is Ori Danieli. I'm the Executive Director at Technion Australia. For those who are less familiar with Technion, it's Israel's Institute of Technology, and among the world's leading dedicated to science, technology, and engineering. Technion is actually Israel's first university, and for the past just over 100 years, has been on a mission to create a better, stronger, and more sustainable world. And 2020 has been no exception. There's about 40 or so groups at the Technion working hard to find solutions and applications and different things towards finding a cure for COVID-19. Technion in Australia specifically is part of a worldwide network of about 25 or so associations with a mission to support the Technion by fostering research collaboration and encouraging philanthropic support for research, infrastructure, and scholarships. Of course, all our guests are very important, but I do want to acknowledge a few very quickly. Technion's Vice President, Professor Alon Wolf, is with us on the line. Technion Australia's President, Dr. Ruth Ratner, Australian Ambassador to Israel, Ambassador Chris Cannon, and the Israeli Ambassador to Australia, Mark Sofer, whom we'll hear from in a minute, as well as the CEO of the Australian Academy of Science, Anna Maria Arabia, who is also the moderator for today, which of course we'll hear from. Today's discussion is meant to be interactive, and you're encouraged to ask questions, so feel free to put your questions on the Q&A section or on the comment line on Facebook if you're watching through Facebook. But before we dive in, it's my great pleasure to introduce Mr. Mark Sofer, Israel's Ambassador to Australia, to formally welcome our speaker and guest. Mark's originally from London, but has been with the Israeli Foreign Ministry for over 4 decades now. He has held diplomatic positions in Peru, Norway, and New York City, including ambassador roles in Ireland and India. In 2017, he commenced as the ambassador to Australia, and he's been a great supporter of Technion Australia. Thank you for being with us again today, Mark. Over to you. Thank you.
Thank you very much indeed, Ori. Thank you very much, and good evening, everybody in Australia, and afternoon, everybody in Israel. Just a few words of introduction, if I might. Australia is often, and correctly termed, the lucky country for so many justified reasons. Israel, on the other hand, is often seen to be living in one of the world's perhaps worst neighborhoods. But in one major sense, and paradoxically, we are lucky too. We have now discovered vast reserves of gas. But until recently, we had almost no natural resources whatsoever. No oil, no minerals, no chemicals, no mining. And as a result, we were coerced into developing the only resource that we actually did have, which was the human resource. And we did so, frankly, very successfully, which propelled us into the forefront of international innovation, technology, what is now known as the startup nation. Australia, in fact, had no need at all to develop human resources due to the huge natural resources it has at its disposal. And the fact that it did so is a testament to good policy, foresight over the decades, and to the quality of manpower and the academic institutions that you have here in Australia. Today, we are both on the same page. Israel has reached this leading level because, frankly, we had no natural resources, and Australia reached this level, we did it because we had no natural resources, and Australia reached this level despite having massive natural resources. In other words, one had no choice, and the other made a conscious choice. But the bottom line is the same, and we are both at the same place, as I said. The question we really need to ask is, are we sufficiently harnessing our human resources achievements for our mutual benefit and for the benefit of our societies around us? And sadly, I fear that the answer is not enough, or no, even. And that is exactly why I'm such a firm believer in webinars such as this. Professor Aaron Ciechanover, a Nobel Prize recipient at the Technion, and of course the Technion itself, our pride and joy. These are, from our side, the best, the creme de la creme, what we can offer. And of course, Anna Maria, the chief executive, Anna Maria Arabia, the chief executive of the Australian, the world famous Australian Academy of Sciences. You are the representative of what is everything wonderful that Australia has to offer. And so it is webinars like this, which enhance cooperation between Israel and Australia and will actually benefit, I believe, the world at large. We all have so much to gain by it. So I look forward very much indeed to listening to what everybody has to say, what you have to say this evening, and I shall be glued to the screen, even if I won't be seen. Thank you very much indeed, and I wish everybody a wonderful evening.
Thank you, Ambassador. Now my pleasure to introduce our moderator today, Anna Maria Rabia, who is the CEO of the Australian Academy of Science. Anna has over 20 years experience in the science field, and she has held several senior executive positions in the science sector, including Deputy Director of Questacon, which is Australia's National Science and Technology Centre, and CEO of Science and Technology in Australia. So handing over to you, Anna Maria, thank you.
Thank you ever so much for that warm welcome and for the opportunity to moderate today. It's my absolute pleasure to welcome our guest, Professor Aaron Shahadnover. He was born in Haifa in Israel in 1947 and is a biochemist and physician. In 2004, as we know, together with Avram Hershko and Irwin Rose, he received the Nobel Prize in chemistry. They explain the method that cells use to degrade and recycle proteins using ubiquitin. This breakthrough has improved understanding and treatment of diseases including cancer, Alzheimer's and Parkinson's disease, and cystic fibrosis. Professor Ciechanover is a member of numerous academies of science, including the Israeli National Academy of Science and Humanities, the National Academy of Sciences of the USA, and the Russian Academy of Sciences. He has received more than 100 honorary doctorates, including one from the University of New South Wales in Sydney. He is currently a distinguished research professor at the Technion, Israel's Institute of Technology in Haifa in Israel. Australia and Israel have a long history of collaboration in technically advanced areas of research, and we are always looking for new opportunities. Australia and Israel's bilateral science, research and innovation relationship is underpinned by the Australia-Israel Agreement on bilateral cooperation in technological innovation and research and development. It came into force in 2018 after a Memorandum of Understanding on Cooperation in the Fields of Science and Technology was signed in 1987. Certainly a long history joining our two countries. Both countries are expected to benefit from technological innovation and research and development partnerships through these agreements. Australia has a significant interest in boosting its technological innovation capacity, and this can be realised through partnerships with Israel, which excels in translating publicly funded research into commercial outcomes and business entrepreneurships. I'd now like to welcome Professor Ciechanover. Welcome, Professor. Thank you for joining us this evening.
Hello, good evening to Australia from my laboratory in the Faculty of Medicine of the Technion in Israel.
Fantastic. We have about 40 minutes together to explore many topics of interest to our audience, as well as leave them time to ask some questions of you. So I'd like to start with a few questions about you and what drove you and your interests as a child. And of course, we know you're a practicing biologist who won a Nobel Prize in chemistry. We'll come back to that later. But was biology always an interest of yours, Professor? Were you one of these children who dissected worms in the back garden or made ants explode using a magnifying glass in the sun? Were you that sort of child, always interested in biology and the world around us?
It looks like you know exactly what I did as a child. How do you? I grew up, I was born in Israel, actually I was born in British Palestine, just on the verge of the establishment of the State of Israel in 47, a month between the country, before the country was recognized officially by the United Nations, which happened in November of 47. And I grew up to a relatively poor family. My father was a cleric, my mother an English teacher. I had an elderly brother. At that time it was a small city, now it's small also, Haifa, which is, I'm now in Haifa, sitting on the bay, on the Mediterranean Sea. and our home was just next to the mountain, to the naked mountain. So obviously, I explored the mountain, dried flowers in the books of my big brother, which led to several explosions along the way, and collected animals and so on. So from the very beginning, I was very much interested in biology, asking simple questions: why the leaves are green, why the the skies are blue, why the blood is red, and so on and so forth. And at high school, I decided to specialize in biology. So at that time, you could already take specialty tracks, and I picked up biology. And at the end of high school, I had to take a decision. You know, in Israel, at the age of 18, almost everybody is going to serve in the military, but the military gives you an opportunity for certain people at certain professions to go and study first. It's called the academic reserve, to study a profession that the army is at need of. And I decided to study medicine. At the end of the day, it turned out that this is a profession that my mother wanted me to be, but I'm not sure that I wanted to do. But you know, you're under the influence, a Jewish influence of your parents. And I joined the academic reserve and started my medical school in the only medical school that was in Israel at the time, at the Hebrew University Medical School of Hadassah in Jerusalem. But at the middle of the road, I had again serious doubts, you know, what I want to do. And I took a year off, which was kind of courageous at that time to stop studying. And I took a year in biochemistry, and that's it. I fell in love. But I had to complete my studies because I had to, I owed the military. They postponed my service, knowing that I'm coming as a combat physician. And I served full 3 years as a combat physician in the military, including during the War of '73, which was a unique experience. I'm not regretting the service at all. It was fantastic service. But when I was discharged, I still had a short stint in surgery. But then I joined the newly established, really at that time, Faculty of Medicine of the Technion, and a young professor that just came, Avram Hershko, that came himself from a training in the United States, establishing the Department of Biochemistry, and the rest is history.
That's fascinating. Thank you. You know, you mentioned military training and the fact that most students in Israel will go through that. How much do you think that influenced your decisions? And indeed, how much was living and working in Israel an influence on your choice of career? Do you think if you were born elsewhere and without that obligatory military training, you may have pursued a different career?
You know, I'm a scientist, so scientists rely on experiments. I cannot repeat my life in a different environment. I know what I know, and I can live again the life that I have lived so far. But living in Israel gave me a lot. You know, my parents came to Israel before the Holocaust as young kids, sensing that something is being, you know, cooked in the air. My father hated, they both came from Poland with their families, and my father hated Poland. He never thought that, or he never dreamt that my foot will step again on a Polish, not again, will step ever on a Polish soil, but science is science. It's different. I think that in his will, if he would have known it, he would have forbidden it a priori from me going to Poland ever, but you know, we are living in different lives these days. And living in the country and serving in the military and seeing the country evolving and the difficulties gave me a lot. You know, it's 2,000 years of history. It's and now, of course, it's the culture, the songs, the food, the family, the Bible, the studies around the Bible, the temple in Jerusalem. It all, you know, it shapes you. And the military service is unbelievable. It's a great melting pot. You know, you're equal in the military. I served with people that came from all different layers of the... I was a physician on a combat missile ship during the war, which was an unbelievable experience. People that coming from all layers of the society, from all kinds of ethnic groups. And it melts you into the society. It was an unbelievable experience that I don't regret for a second. It was part of my maturation. And at the end, there is enough time in your career to accomplish whatever you like.
Yeah, although sometimes when we're younger, we feel impatient, but I think that's a very sage observation.
I know,
Professor, may I...
just one more comment, which is a more kind of a philosophical comment, because I did a lot of things. You know, you are studying medicine, you go to surgery, you go back, you serve in the military. And I don't think, you know, when we are young, we are looking at age and at our progress with ambition. We want to become a doctor. We want to move to the next step. From my age, and even before, life is, in my opinion, has no purpose. I think that life is a collection of exciting experiments and experiences. Then we are going from one to one, because once we are going to leave this world, we anyway not going to accomplish everything and to discover everything and to know everything. So I think that we should take life as a collection of experiences, trying to enjoy each and every one of them, and then move to the next one.
That's very wise words. May I move the focus to the Nobel Prize now? Could you just briefly share with the audience what led to the discovery of Ubiquitin system that led to the award of the Nobel Prize in Chemistry in 2004? And as part of telling us that, did you know you were onto something when you were doing those experiments? And I guess what would you say to young researchers battling day in and day out, doing their experimentation on what sometimes feels like you know, work that may not have clinical or technical application? Did you get a sense of the importance of your discovery as it was happening?
Well, I'll try to do it briefly because it's a very long story. But when I decided to go to do my PhD in the Technion, departing medicine, practical medicine, I looked for mentors, and I scanned several mentors, and each of them knew exactly what I'm going to do. And you work on this protein and on that protein, and so on. And the only one that was kind of adventurous was Avram Hershko. He just came, he was a young scientist. He was a non-tenured assistant professor. For those in the audience that don't know, this is the lowest rank that you enter academic life. You don't have a tenure, you're not permanent, and you're an assistant professor. It's the lowest rank. He said to me, you know, there are signs that there might be some system that I may try to explain you briefly in a minute. But it's not sure, and you are taking a risk, and you may kill your career. And then I said to myself, well, I can always fall back on medicine. And therefore, along the initial phase, what I did on-calls in the hospital, so not to lose my manual skills in surgery. And I like this adventurous. I'm always taking risks, and I am adventurous by character. And I like this approach. And we decided to go together, but it was his idea. He brought it from his postdoctoral training in the United States. He just returned from the States and got this department as a young scientist. And what is the idea? The idea is we are made of proteins. We are made of 25,000 different proteins. I will not go into the chemistry. I will not go into use any technical jargon, but just to give you an example, the red color of the blood is a protein called hemoglobin, which is very important. It carries oxygen from the lungs to the tissues, providing them with the ability to generate energy, and then carries out carbon dioxide, a toxic gas, out when we expire it. And the muscles that are moving are protein. The sensors in our eye that see the world and transmit the light into a picture, and then the interpretation are proteins. The antibodies that we are now looking for with the flashlight to fight COVID are antibodies. So we are made of 25,000 different proteins. We are made of 25,000 different proteins that are playing for us a wonderful symphony called the Symphony of Life. But unlike a regular symphony orchestra, they don't need a conductor. Every protein knows what to do. I don't think now when I'm talking to you about how my stomach works and how my kidney works and how my back muscles hold me straight, looking to the camera, and so on. I hardly think of what I'm going to say. This is the only thing that I'm thinking about actively. All the rest is occurring behind me, automatically due, thankful to the wonderful work of those proteins. But the proteins are long chains. They are like words. They are made of letters called amino acids, but they are very long, unlike a typical letter that is only 8 letters. A typical word that is only 8 letters. These are very long words made of many letters, and they are very sensitive. They are sensitive to temperature. they are sensitive to irradiation, they are sensitive to mutation. And the simple experiment that I can give you is take an egg and throw it for 5 minutes into boiling water. An egg is made among other components of protein, and you'll get a wonderful hard egg. The easiest thing to do in the world. But try to the opposite experiment, try to take the egg and make it natural again. Nobody, and I repeat it, nobody in the world has done it. There is some damage that has been caused to the protein, which is temperature dependent, that killed the protein and took their function away. Then you ask me, this example is irrelevant because you are boiling. We are not boiling ourselves. Yes, we are boiling ourselves to a certain extent, because let's do a milder experiment. Let's take a fresh piece of meat and put it on the table and go to work instead of freezing it or cooling it in the refrigerator, and come back after the day and see what happened to it. It becomes greenish and brownish and smelly, and we have to throw it away. Something happened to the proteins that stayed on the table rather than being at the low temperature. So what's the relevance of the example? We are not living at room temperature. We are living at 37 degrees. It's a high temperature. So what's the difference between the piece of meat that a day before was part of the cow that was living and eating and giving us milk, and now it's on the table? That the same damage that the temperature causes to the proteins in the piece of meat on the table is also being caused as we speak now, while we are alive. But in the body, we have a mechanism, in the living body, we have a mechanism that spots these damaged, temperature-dependent damaged proteins and removes them and makes new ones to replace them. Just to give you the number, every day, we are removing between 5 to 7% of our proteins and replacing them with new ones because they were damaged, and we cannot accumulate them because they will be harmful. And we'll talk about what the word harmful means. And what we discovered is this exchanging machine that, if not working properly, leads to results in many, many diseases, including neurodegeneration, Alzheimer disease, Parkinson, and so on. So it's a fundamental, basic quality control process that removes proteins that are not needed or damaged or mutated because of temperature, because of cosmic irradiation, because of the radiation of the sun, and replaces them with new one. Now we understand diseases that are related to it, how to treat them, and so on. So it starts, from little small laboratory in Israel and some vague idea, it now has become a huge stream of knowledge, pharmaceutical companies, scientists working on it all over the world. Just to answer your last question, whether we knew it, no, of course not. At the beginning, for sure not. You are busy with your problem. We knew that what we are finding is novel, but we didn't know that it's important. Not everything that is novel is important, and not everything that is important is novel. That's always true in science. But along the years, it became important because many other people came to the field and realized that the protein that they have been studying for long are kind of exchanged via our system. Then pharmaceutical company came, a patient started to show off and to be cured or being helped and assisted, bettering their quality of life, and so on. And gradually, it took years. It took almost more than 20 years to full recognition. It became a whole field, and it's still exploding in front of our eyes as we speak.
It's absolutely fascinating, and such a common story amongst Nobel laureates who make such significant discoveries very early in their career, and then it's only realised later on. Could I move to research in Israel more broadly? Now, Israel has the highest national expenditure in R&D as a percentage of GDP. And let me tell you, in Australia, we're always envious when we read the investment figures in Israel. And you have an innovation ecosystem, which is one of the most developed in the world. What do you think's been the global impact of that investment? And indeed the impact of the many startups in Israel? After all, there is the largest number of startups in Israel per capita in the world. What do you think the impact of those both investments and that culture is? And your own work, of course, is part of that.
Yeah, it's a good question. Israel has an appropriate ecosystem, and certainly it invests a lot of money. I will not go to the number, not because they are secret, because the Israeli government will not tell you exactly how much they invest in defense industry, which is also R&D, and how much go to civilian, to universities and to civilian. Also, the universities are involved in a defense industry. You know, the Faculty of Aeronautical Engineering or Mechanical Engineering in the Technion that is doing robotics are all enjoying also grants from the Ministry of Defense. So it's mixed. We are, I think, #1 in the world. About 4.5% of the GDP go to research and development. But as I say, it's a mixed bag. I think that we are head to head with South Korea about these numbers. But this is not the most important thing. The most important thing, I think, is the establishment. There are two other things. One is the establishment of an ecosystem by the government that encourages it. So the government encourages translational research. They go and scan and publish advertisement for grants that will lead to products, not even directly, but indirectly, enrich the knowledge that at the end will be translated to research. Every ministry has its own chief scientist, but the biggest chief scientist is the chief scientist of the Ministry of Economics, and it's a huge office, and he enjoys, I cannot translate it to Australian dollars, but it's several milliard Israeli dollars. The exchange rate of the Israeli dollar to the Israeli shekel, sorry, to the US dollar is about 3.5 now, so you can calculate. So we are talking about several good $1 billion of money just at the hands of the government. And there is also investor banks and angels and so on. So the ecosystem is very, and also the universities are very generous. So if I have, all the patents belong to the university, so the knowledge of what I do here belong to my university, but the university will not rob me. So a priori, any pound at the end that will come to the university will be shared 50-50 with me or with the inventors. Of course, if there will be investment, it will be diluted, but between me and the university, it will always be 50-50. So you have an incentive not to hide from the university, but rather to use the tools that the university has developed in order to recruit people in, to bring investors. We have an IT office here, which is very active in registering patents, even if there is no investment yet. So I think that we have built a very strong ecosystem to encourage it. So it's not only the investment in funds, in hard cash, but also this. And then there is something that unfortunately, I cannot tell you what is the secret again. It's not the A-bomb of the state of Israel. It's the DNA of the people. People in Israel are explorers, they are entrepreneurs, they are adventurers, they try, they think differently. It's something that, especially, it's not Australia. Australia is very Western in its culture, but you know, there are universities that are much better than the Technion in the ranking, like in Korea or in Singapore, and even in China, they exceed us. But nevertheless, they come to learn from us. And unfortunately, I don't think that we can teach them because it's our DNA. You have to rub shoulders in order to have this DNA injected to the other side. And even then, you are not sure. It's something in our character. Maybe the military service that educates you for complete independence. It takes young people at the age of 18, 19, makes them officer responsible for the lives of other people, overcoming on their own problems. It's something else that is an important ingredient in this, what I feel is a success story.
Yeah, it certainly is. What would you say to the Australian government about its investment in research and development, and in particular its relationship with private enterprise, especially now that we're experiencing straitened financial times because of the global pandemic?
Well, for the global pandemic, I cannot tell anything because even the budget of the Israeli government will shrink. There is no doubt about it. They will have to direct it to different purposes. And I don't know. I just want to comment on the introduction of Mark at the beginning of this event. I don't want to advise governments and so on. They know what they do, or maybe they know less what they do. But I'm not an advisor. But for sure, you should invest in manpower. You should invest in brains of people. It doesn't matter how rich you are. Israel, as Mark mentioned, didn't have any choice. Now we have partial choice because we found gas in the sea, and so on and so forth. But now you see that the gas prices are going down, so the billions of dollars that we thought are in there are now shrinking to much less than we thought we had. So you see, the natural resources are changing. You know, think about oil. Think about the rich countries that surround us, Saudi Arabia, and the countries that were floating on oil, how they look. Think of Venezuela. What happened to this rich country when the oil prices went down? So you should know, think about Chile with the copper. I can bring you numerous examples of countries that relied on what is under the ground, and then everything collapsed. But manpower never collapsed. You know, new ideas and right education, it's an eternal value. And, you know, for energy, we can use the wind, we can use the sun, we can use the water, we can do a lot of things. I think that the investment in manpower is the best bank that any country can dream of, because the return on this investment is better than any other bank that you'll ever invest your money in.
I think that's very, very wise. Thank you. So moving now to the pandemic, it's been 6 months since the World Health Organization received its first reports of what we now refer to as a cluster of cases of pneumonia of an unknown cause in China. And the world's had nearly 13 million COVID-19 infections and close to 600,000 deaths. And globally, of course, there is a race for a vaccine which has seen unprecedented international cooperation. Are you hopeful that an effective COVID-19 vaccine will be developed in the next year or two, or in a different time frame? And perhaps if you could share some specific examples of what your teams at the Technion are working on in this regard.
Yeah, the pandemic surprised us. There were previous pandemics in the recent decade that luckily they didn't go out of certain either population like AIDS or areas like Ebola in Congo or SARS or H1N1 in China, but this one is different and it hits us all. It's a very strange disease because once you get it, and especially if you are in a risk group, then you are at risk. But if you look at the number of the people, all in all, it looks like a mild disease. I mean, on the average, I'm not talking about the single patient that needs to be put on the respirator and develop blood clots and cytokine storm and all the complicated side effects of the disease. It's then very severe. But the world knows how to deal with the pandemics. Even in my lifetime, I remember in the early 50s as a young kid, my parents shivered, you know, they had the shiver going through their spine that I'll get polio. Neighbors around us succumbed to polio with the ultimate side effect, which is paralysis. Most of them went out of it with a like mild flu or mild cold, but some were paralyzed. And here came Jonas Salk and then Albert Sabin initially with the dead vaccine, and polio is basically out of the world. And the same for an AIDS. Also, now we know more or less how to control it. So the way to make it, to make a vaccine is kind of paved. We know what to do, but we need to be patient. You know, we cannot, one big disadvantage, one negative phenomenon that we faced during the pandemic are the fake news. Yes, I have it. Yes, try hydroxychloroquine. Yes, try ivermectin in South America. I can bring you numerous stories. To develop a vaccine, we just heard very good news from Moderna yesterday about the messenger RNA, which is a new way of making a vaccine. It's not the typical vaccine, not the typical way to make a vaccine. At the end, it's an antibody. But we need to think about three phases in vaccine development, and we cannot circumvent any of them. One, the vaccine has to vaccinate. That's what we demand from it. Once we are vaccinating people, the people have to be resistant to the disease. We know that it's not always true. So in influenza, we know that only 60% of the people that get the vaccine are vaccinated. The FDA just reduced the red line required from corona to 50%. The demand from the companies will be to be at 50% vaccination rate. Now, how do we know that it's vaccinated? There are two ways to know it. Either we take a small group of people, we vaccinate them, and then we infect them with the disease. This is a kind of courageous experiment to take people and to inject underneath their skin a live virus. We cannot do it on pregnant women. We shall not do it on children. We shall not do it on adults and we shall not do it certainly on adults with background diseases. So we're already excluding from the experiment very important groups that we need to know about it. Another way to know whether it's vaccinating is to vaccinate 2 million people and to let them go and to see how many of these 2 million people get the disease versus 2 million people that were not vaccinated. So that's a long experiment, you know, for 2 million people or 1 million people that have all the age groups. By the way, Moderna vaccination, all the candidates that were vaccinated had side effects, pain, nausea, fever, whatever. So now I come to the second demand from the vaccine. It should be safe. Don't forget, we are giving the vaccine to billions of people, and we cannot say, okay, every one of them will have fever for 4 days and will not go to work. Can you imagine that the whole world doesn't go to work for 4 days? Not, it shouldn't be the same 4 days, of course, but think about the loss to economy. So vaccines, and I'm not talking about other side effects, you know, maybe precipitating the disease itself. So it has to be safe with no side effects or very mild side effects. And third, we need to produce billions of aliquots. And I can tell you that not only that there are no factories that can make it, and probably only the rich people will buy it, like America now bought all the stock of remdesivir. It's a drug, it's not a vaccine. And from the company not making it available to any other country in the world, good or bad, whatever we think of it, you know, money talks here. So we need to produce it. And nowadays, we don't have even glass vials to put the vaccine in. And the glass is a very unique glass. It's a crystal glass. It's not the glass of Coca-Cola, of Coke drink. It's a glass that doesn't secrete any materials to the solution. It's a glass that doesn't absorb the vaccine to itself. So, you know, so all this, it has to vaccinate, it has to be safe. And we need to make it, and then we need to pay for it. These are obstacles that we have to overcome. So I think we are talking a year or two, as you indicated.
Yeah, thank you. May I return to something you said earlier around the rise of social media and fake news posing a significant threat to, I guess, the public's confidence in science? You know, we hear stories that are just outright wrong and they're shared widely on social media. They drown out experts, they prevent compliance and physical distancing and other measures that we need the population to take. The spreading of anti-vaccination messages, and you know that extends outside of the pandemic. Of course, we've seen the extensive denial of climate change as another example. How do you think academies of science and scientists more generally should counter or respond to these sort of trends?
I think that the response should be very strong and very sharp and very clear. Because people don't understand what is science, how long it takes. I just try to explain it with one example, and that's a sure way to develop a vaccine, because at the end we shall develop a vaccine. There is no doubt about it. But the way, it's very long, and we have to test every step and to make sure before we move to the next one, because lives of people are at stake. And you know, if people say, okay, hydroxychloroquine works, let's try it, and then it doesn't work, then we wasted lives because we gave people something that we were waiting and waiting and waiting for it to act. It didn't act, but meanwhile, they deteriorated. And we don't count these lives. And I'll talk to you a little bit more about even more indirect effect of this fake news. And I think that the role of scientists themselves and academies of science and ministers of science and the government, even the politicians, to explain to the public that we are doing all we can. But that's the way it goes. We are not going to release a product that doesn't withstand the strictest standards. We may expedite it a little bit. We may do the experiment a little bit more faster, but not at haste. We should be very, very careful, because these vaccines or drugs are dangerous if they are not used appropriately, and if they are not given to the right patients. And it's not only hydroxychloroquine that Trump advertised, and unfortunately our prime minister bought from India doses worth millions and millions of dollars without even asking what's going on, and so on. So we should be very careful about it.
Thank you. Could I move to some broader problems that have been caused by COVID-19? There are concerns that people around the world are reluctant to visit their doctors during the pandemic for fear of either getting sick or for overburdening the health system. Do you think this is a real concern? And is there a risk that patients may be missing out on being diagnosed with life-threatening conditions or perhaps not getting the treatment they need in a timely way?
Yeah, we are still, you know, a lot is dependent on each country and what type of an infrastructure of health they have. In Israel, we have a very good health system, a public health system, which is very good. The only problem is shortage of manpower. So the system can collapse. You know, once we are crossing a certain red line and the red line is not far away, the system will collapse. But the manpower itself is a superb manpower. The hospitals are very good and so on and so forth. So it really depends on the health system. I believe that in Africa it may be different, or in South America, or in the mountains of Peru, it is different. And the problem is the diagnosis of the disease, of course, and the testing. There were many tests. Now there is one that is available in Israel. Now we increased the number of tests per day to almost 30,000 per day, and our population is only 8 million or 9 million people. So, and we need to do repeated testing, because the negative test of yesterday is not the negative test of tomorrow. You may have contracted the disease. In between, we have to go to repeated testing. We have to isolate cases. What's going to be threatening is the winter. In Australia, I remember you talking about freezing there. In Israel, it's the height of the summer now. We are in July and August, which are the hottest months. But when the winter comes, it will be mixed with influenza. We always have a flu pandemic. Well, it's not, we don't call it pandemic, but we have an epidemic of flu in the winter, and then patients will not know, because many of the symptoms are similar, you know, between cough and fever and difficulties of respiration. And then we shall need much more knowledge and much more efficient testing in order to make distinction between the people. And we are afraid that in the winter, if we shall not be able to distinguish between these two similar diseases, then the medical system might collapse indeed. So yeah, it's complicated, especially now it's isolated, so we know what to do, but the winter may confuse us, and we are very much concerned about it.
Yeah, thank you. Professor, we have a couple more minutes before we accept some questions from the audience. So I've got one more question for you, and that's hopefully looking at a more rosy future for the world, and just turning attention to personalised medicine. So advances in medicine and technologies that support it are really poised to reshape healthcare, invigorate biotechnology, and ripple out into fields such as agriculture, environmental science, and beyond. Where do you believe medicine will likely be in the next 5 to 10 years, particularly in relation to the treatment for cancers, but not only in that area?
Indeed, this is, I'm not, by the way, I'm not in a bad mood. You know, pandemic will go away. All in all, the future is bright. There is no doubt about it. I am very optimistic. You know, there have been darker periods in our history. Think about World War II, the Holocaust. 20 million people died during wars. Russian. Think about the curfew of Leningrad and so on and so forth. So all in all, it's okay. But hopefully there will be peace in the world. You know, the pandemic is the least threat, I think. We need also peace among countries and more talking to one another. But the revolution of personalized medicine is amazing. But it's not only personalized medicine. It's agriculture, as you mentioned. It's everywhere. It's the technology. We are making better crops that are resistant to different natural hazards and so on and so forth. For medicine, it's great, because let me just explain it very briefly before we go to the Q&As. Medicine of today, with all its advantages, is kind of what I called one size fits all. It's a type of a pajama or a treatment. What is pajama? Pajama is something that we buy in order to warm ourselves, but when we buy it, we don't care much about the size. You know, there is small and medium and large, and in between there is the rubber band. And it's basically one size fits all. When a patient comes with a cancer, which is metastatic or something, God forbid, either we can operate on it, or we bombard the patient with chemotherapy and radiotherapy that goes well beyond the tissue itself that we want to target. Side effects, balding, vomiting, bone marrow suppression, whatever you just think about it. But this is not the treatment. You're not shooting a fly with a cannon. You're shooting a fly with a needle. And what happened is that we now start to identify the needle that we can punch this fly. And the needle is called our DNA. What happened is the revolution started. We are still in the middle of it. In the 90s already, when we said, how is it that two patients are coming to the clinic with the same disease, more or less, always never can be identical, and we are treating them the same treatment, and one responds wonderfully, and the other one just deteriorated and succumbed to the disease. What's going on here? How is it that the response of two patients to the same treatment, carrying the same disease, is vastly different, and then in between, there is a whole range. Some do respond, some develop side effects, some respond partially, some, what is it? And then we realize that their DNA is different. The reason for the disease is different from one patient to another. We are very naive to think that breast cancer is breast cancer. It's one entity in the textbook of medicine, but it's not. There is breast cancer that is due to mutation A, and breast cancer that is due to mutation B, and breast cancer that is due to mutation C. Think about, since I am an avid driver, I like to always compare it to cars. Think about a cold morning that you cannot turn on your car, and that's the disease. It's called, I cannot turn my car. But the reason behind can be that the battery is empty because you forgot the light, that you forgot to put gas, that the sparks got wet because of the rain, that you forgot to put oil and the cylinders are stuck in the barrels. It can be many. And if you replace the battery to a car that doesn't have oil, it will still not start. So we started by developing a technology to sequence the DNA. We started to see that the diseases are diverse, and each of them requires a different disease. So if we go to breast cancer, patients that have a mutation in the EGF receptor, for example, again, without delving into deep jargon, need Herceptin, and patients that have a estrogen receptor mutation need tamoxifen, and so on and so forth. And there is not one breast cancer, but there are 20 of them. And each of them is a different disease, despite the fact that it misleads us to think that it's one disease because it's a tumor in the breast. Yes, it's a tumor in the breast, but the reason for the tumor to grow is different. And I think that now we are carving the way to better understand at the molecular level what's going on and to develop individual drugs that will change the face of medicine. They will be much more efficient, much less side effect, and we shall benefit from them enormously. But as I said in many other lectures, there are no free lunches. It's going to be costly not only by cash, but we are going to pay for it with our privacy and invasion of our privacy and so on and so forth. It's not going to be simple.
Thank you. Thank you very much. Professor Shahadnover, we have a number of questions from the audience. I'll read a couple of them. What are the key challenges we are facing globally and locally in medicine in terms of research areas and scientific capabilities?
I think that I'm not talking about energy, and I'm not talking about, I see big danger. If you ask me what is the real challenge, is climate change. Forget about medicine. Climate change hasn't taken a sabbatical and not a weekends during the pandemic. And if we are not going to think about it seriously and globally, we are going to destroy this planet in no time. We don't notice it because we say it's not my business, my children will take care of it, but it's coming and it's accelerating. We should take it extremely, extremely seriously. In medicine, I think that the big challenge is the brain. I think cancer will be defeated. 5 years, 10 years, I don't want to prophesize, but we are making, with immune therapy, we are making head on with the cancer. The landscape of cancer nowadays is not the landscape of cancer 10 and 20 years ago, but the brain is still a big mystery. And the brain and neurodegenerative diseases like Alzheimer, like Parkinson, like ALS, which is relatively rare, like other dementias, are going to be a huge emotional and economical burden on family and on medical economies. And we are still kind of far away. We don't understand the basic mechanisms, and a lot of research has to be done before we shall have efficient drugs to treat brain diseases. So if I have to, it's not still the major killer. The major killer in many countries is still cancer. In Israel, cancer is number one. Heart and vascular diseases trails behind, but not too far away. Any different between different countries, these two are competing all the time head on with one another. But the brain is a very big challenge. But I repeat it, I'm not in the field, but the climate change is the big threat on our existence on this planet.
No truer words, thank you. To follow on from that, what are the implications of your research on Alzheimer's disease and dementia, is a question from the audience.
Okay, so let me start. We are just now in middle of another disease that we are studying, and a paper will come out in a day on Huntington disease, which is a similar disease, but we chose it because it's more accessible experimentally. You don't always work in a disease that is more common. You choose a disease model that is also accessible experimentally. So, but that's for the scientists to decide. You know it, Anna Maria. But what happened first with our system, that companies developed drugs for, and I'll tell you a very heart-touching story in a minute, developed first drugs for cancer, and mostly for blood cancer. All the drugs that are being used today to multiple myeloma, which is a kind of leukemia, it's a blood cancer, are based on our discovery. In the landscape of the disease that was fatal until about 10, 15 years ago has changed dramatically. People are now cured, not all of them. People that are not cured are living 5 and 10 and more years with high quality of life. Except for immunotherapy, I think that multiple myeloma has changed its face in a big way. I remember as a medical student, people died in agony in 1 or 2 years into the diagnosis. Now I'm a member of different multiple myeloma societies, very different. But because our system is there to remove faulty proteins, and because the hallmark of almost all neurodegenerative diseases, like Alzheimer, are faulty proteins that are not degraded and should be degraded, I'm very hopeful that along the line, I mean the scientific community, will develop drugs based on our system to tackle also Alzheimer and Parkinson, because this is, again, this is the target of our system. Our system was built to prevent Alzheimer, and I believe that if I don't have it, it's because my system is working properly rather than improperly, and then unfortunately, I'll succumb to the disease. But again, because we don't understand, the brain has another problem, which is called the brain-blood barrier. It's very difficult to bring drugs into the brain. The brain shielded itself with a stainless steel shield that doesn't allow drugs to come in, especially not, well, of course you can inject it, but daily you cannot do it. So therefore also brain tumors are very problematic to treat, and so on and so forth. But I'm optimistic that we know why Alzheimer is there. We know why Parkinson is there. We know the problem. We still don't know how to penetrate into the brain or efficiently, and we still don't know how to tackle these aggregated proteins that are not degraded, but I am optimistic.
Thank you. And a personal thank you. My mum had multiple myeloma and certainly lived many years beyond what would have been the outcome of that diagnosis. So a personal thank you for your work. We have a question.
Let me just, Anna Maria, one moment. It's probably one of the, I had several exciting, people are asking what was the most exciting moment in your life. There were several of them, but one of them was in Stockholm when we got the Nobel Prize. And it's not the prize awarding, not that this was not exciting, it was exciting. The prize is always awarded on 10th of December, according to the will of Alfred Nobel. That's the day that he died, and that's what he asked in his will. And it happened to be around, it's always around the Jewish holiday of Hanukkah, which we light candles and celebrating some miracle that happened during the temple days. And the Israeli ambassador gave us a party on our behalf. And Sweden is a very anti-Semitic country. And for the Jews in Sweden, it was a big holiday that here, not only Jews, but Israeli scientists are being awarded without discrimination the most important prize in the scientific world. And then in the middle of the ceremony, when we lighted the candles and were singing, he said, I have a gift for you. And a gift for me is a very simple metaphor. It's a box wrapped with a nice violet paper with a ribbon on it, maybe a rose attached to it. And no, it was a walking human being by the name of Johannes Oscarsson. And he came with a story that until a few weeks beforehand, he was lying on his deathbed. He was dying of multiple myeloma. Remember, this was 2004. There were no drugs at the time. The drug was only experimental, was tried by American physicians under the supervision of the FDA, the Federal Drug Agency. But the physicians in the Karolinska Institute in Stockholm raised their hands and they said, our only hope is this compassionate treatment. And they asked the Americans to fly it in. It was flown in, and the rest is history. He was walking on his legs, healthy, because I shook his hand. He was healthy, strong. His hemoglobin was back, and with tears, he thanked us for giving him his life back. Now, for me, it was a very important moment. The reason was, one, because I left medicine. I departed medicine. I decided that I'm not going to treat patients one-on-one. I never knew that I'm going to develop drugs or being involved even remotely. But it told us that, yes, you can help people even without being their doctor. And it's also, I think, more importantly, it showed you the strength of science. We did not develop the drug. We had nothing to do with the drug. How science is working. We published basic findings. Somebody else expanded them. Then people said, oh, if they claim that the system is important to degrade faulty protein, let's see what's going on if the system doesn't work. So they engineered mice in which the system was aberrated. And then the mice developed diseases. One of the diseases was myeloma. And then they said, if there is a disease, let's try to treat it and correcting the defect in the system. And then the drug came. It's a chain of people that don't even know one another that at the end can bring drugs to the market and save the lives of millions of people. I think that that's the beauty of science. It's hard to see when you are enclosed in your little laboratory with your little test tube. But once you have an opportunity to look from 40,000 feet, you see the chain of people that transfer the torch like in the Olympics to one another without even seeing them. And then at the end, the torch brings life to people. And the first runner had no clue how the last one is going to be transferred. I think that this is the main lesson, that you should invest in basic research because you don't know what's behind the corner.
And right there is a story of science. Thank you. You're an absolute inspiration, Professor Shahadnover. And I know the online forum is wonderful because it allows many to participate. But what we can't see is everybody clapping and thanking you for your contribution today. There are so many more questions that have come in through the Q&A channel, and I'm sorry to our audience because we do have to wrap up there and I'm not able to read out any more. It's been an absolute pleasure to have your insights and your expertise shared with so many today, and a real privilege for me and for many to be able to speak with you.
You know, I'm just last closing comment. For the last 4 months, I've been exhausted by Zoom. Not because I'm sitting in front of my screen, not seeing anybody, not sensing the audience, the body language. You know, I even lost my sense of humor because typically I try the audience by telling little subtle jokes and then see whether they are with me or fell completely asleep. And now I even cannot use my little sense of humor. But at the end of the day, not only that I hope to come back to Australia, I've been to Australia several times physically, but there is no substitute for human touch.
I agree. Yeah, I agree. It does feel like we've used Zoom far too much. but you're right that it's the subtleties of human interaction. I'm really grateful to everyone who's been able to put aside some time to join the webinar, and a special hello to His Excellency Chris Cannon, the Australia's Ambassador to Israel, who I understand has participated today. And thank you to our event partners, the Israeli Embassy in Canberra and Ambassador Mark Sofer. There were more than 300 people registered to attend today's webinar, and this shows the interest in science and research that's being undertaken in Israel, and of course their interest in your specific research, Professor. Thank you everyone for joining today's webinar.
Bye-bye.
All the best. I'll hand over to Ori for his final remarks. Have a lovely evening or a lovely day. Thank you.
Thank you everyone. I particularly want to thank Mark Sofer and the team at the Embassy for your continued support. To Anna Maria and the team at the Australian Academy of Science, I'm sure we'll do more things together. This was really great. And most importantly to Professor Ciechanover, I know how busy you are, and we really appreciate your valuable insight and invigorating discussion.